Okay, so let's get started. Hi, everyone. My name is Kathleen from Trio's third-party program. Thank you for joining me today. I'm looking forward to answering all of your questions about Trio's third-party program and the services that we offer. Just so everyone is aware, this session is being recorded and you'll have access to the session afterwards. So to get started, you can type your questions into the Q&A box at the bottom of the screen there. And once I get a couple of questions, I will start answering. Okay, so what third-party services does Trio offer? So Trio offers both known and anonymous egg donation. We offer known and anonymous sperm donation. We work with gestational carriers, and we've also recently launched our own embryo donation program, which is available for current Trio patients. For the no, egg donor, you can work with an agency to find a fresh egg donor, or you could also purchase frozen eggs from an egg bank. With donor sperm, we work with known sperm donors through the clinic. We do not work with anonymous sperm donors through the clinic. So, what that means is if you want to use anonymous donor sperm, you have to purchase it through a sperm bank. And we can send you lists of distributors that work with Canadian compliant sperm banks. Next question, can I use your donor embryos if I'm not a Trio patient? So in short, no. So our embryo donation program is open to current Trio patients that have undergone treatment with us. So if you're at another clinic, you wouldn't be able to just join our clinic and then right away have access to embryo donation. You need to be a current Trio patient who's undergone treatment with us already. Okay. Sorry, getting lots of questions here. How old does an egg donor need to be? So for fresh egg donors and through egg bank, the minimum age is 21, and that's an ASRM and CFAS recommendation that we follow. What is the general wait time to be matched with an embryo donor? So we've just recently launched our embryo donation program, and our requirements are very comprehensive. So it does take a bit of time for embryo donors to go through everything. Embryo donors are required to complete genetic carrier screening, which takes 5 weeks at a minimum. And they're also required to complete a 3-month cooling off period. So really, to get an embryo donor completely through the process, it can take anywhere from 4 to 6 months. So hopefully now that we've launched our program, we're getting the word out there, it will sort of start to pick up steam a little bit more, but it's really hard to say what the match time would be, especially given I don't know sort of what you're looking for. In an embryo donor. So it is also a mutually agreed upon match program, meaning that once we find a potential match for you, you both have to agree on each other. And it's also a known embryo donation program. So what that means is that there'll be some sort of level of openness between the two of you. And that can range anywhere from you have each other's contact information and that's it, to you know each other well and you get together at holidays for dinner. So that's another big contributing factor is we're not going to match you with someone who has a completely different desire for level of openness. So it's really hard to say, but I would say you could email embryo donation at triofertility.com if you're interested, and we can chat a little bit more about what you're looking for and then give you a little bit more specific answer. Let me see here. How long does it take to use an egg donor? That's a really good question. So if you're working with an egg donor from an egg bank, this means 90% of the time that these egg donors have already gone through the retrieval process and these eggs are already frozen. So in that situation, it's actually very quick. Once you select the donor, after you complete genetic carrier screening, we're going to compare the results to make sure that you're compatible. And once you're good to go with the donor, you can just order the eggs to have them shipped to us. So that is actually very quick. Where it gets a little bit more challenging is when you're working with a fresh egg donor. So Trio doesn't match you with egg donors. You can either find an egg donor on your own, a friend or a family member, or we can suggest to you consulting agencies that we work with. And then once you've found your egg donor, you need to keep in mind that this is a person with their own schedule. It's a very human process. So things are going to come up that might delay things. It really depends on how quickly they complete their screening requirements, meaning how quickly do they go do the blood work that we send them? How quickly do they complete their counseling session? And then after that, how quickly are they responding to the lawyers to get your legal agreement in place? It really does depend on the donor. And then also, what is their schedule like? When are they available to come in and do the donation? So it really ranges in that sense. When you're matching with a donor, though, generally they'll be very open with you about what their availability looks like. And we'll always do everything we can to get the cycle to happen when it works best for everybody. Oh, I love this question. What sort of genetic testing is done on donors? And can offspring contact the donor after age 18? So we have a policy for the third party program. If you are using donor sperm or eggs, whoever is providing donor sperm and eggs, so example, you're using donor egg, whoever's providing the sperm, you have to complete genetic carrier screening. So we use a company that tests for up to 600 genes. And then we are going to match your results with the donor's results to ensure that you're genetically compatible. And then if there's any concerns, the most common one that comes up is maybe the testing that the donor did wasn't as comprehensive as the testing that we're offering. So maybe you're positive for a gene. Again, very common. Since we're testing for so many genes, it is very common for you to be positive for one, two, three, four of these genes. It doesn't mean you have that condition. It means you're a carrier. So we want to ensure that your donor isn't also a carrier for the same condition. So often what happens if you're purchasing eggs from an egg bank or sperm from a sperm bank, that donor might have not done as comprehensive testing as you have done. So maybe you're positive for one gene and the donor wasn't tested for that gene. This comes up all the time. So in this instance, we would refer you for mandatory genetic counseling. And those genetic counselors are going to discuss with you in depth any future inherent risk involved with using that donor sample when you don't know for sure if they could also be a carrier of that disease. So that way you're going to be able to answer or ask any questions that you have. You're going to feel well informed and comfortable moving forward with that donor. In terms of can the offspring contact the donor after age 18, that's going to depend on what type of donor you get. So there's anonymous and known donors. Some of the anonymous and known donors have the option to only contact after 18, but that's something that you would confirm with the sperm bank, the egg bank, or with the agency that you're working with. Make sure I haven't missed any questions. What are the first steps I should take if I'm interested in the process? So, the first thing you're going to do is you're going to contact your Trio doctor's office to get an appointment with your doctor. So, the doctor is going to discuss your options with you and identify the need for third party. Once you have that conversation with the doctor, you'll be referred to our third party coordinator, and she'll reach out with you to you with all of your options. So, she'll either send you all of the information on the donor sperm distributors we work with or the egg banks. She can go over the process with you if you maybe have someone that you know who wants to be your known sperm or egg donor. And she'll also guide you through the screening process as well. So first step would be discuss with your Trio doctor about third party, or if you're not currently a Trio patient, you would just need a referral to the clinic. Are there specific eligibility criteria for donors? Yes and no. Mostly yes. So if you're purchasing eggs from a bank or sperm from a bank, or you're using a donor through an agency, Generally, these are younger individuals who have had testing for ovarian reserve, AMH or AFC. They've done sperm testing. So we know that there's good potential there. They also undergo psychological screening, infectious disease testing, a physical, and then there's also legal in place as well to protect everyone involved. If you have someone who, for example, you want to be your known egg donor, maybe they're a little bit older than we would generally see, but it's really important to you that you have some sort of genetic link. We can bring them in to assess their ovarian reserve. We can do ultrasounds and blood work just to see if they would be a good candidate. And then if maybe the results aren't as optimal as we'd hoped, you can have a discussion with your doctor so that we can set realistic expectations about the number of eggs you might get, and if the donor is willing to do multiple cycles, that's always an option as well if that's something that's really important to you. How long do you store embryos once they're made? That's a really good question. You can store embryos as long as you want. There's no decrease in quality of the embryos once they're frozen. So a lot of people continue to store them once you're done building your family. Another option is you can donate to them to the clinic for research or for teaching. You could potentially look into our embryo donation program if you don't want to donate those embryos for teaching, or you don't want to destroy the embryos, but you also don't want to pay to keep storing them. So that's a couple of options there. But yeah, definitely our embryo donation program is something to consider for sure. How much does it cost? So that's a good question. It really ranges depending on the type of treatment you're doing. So if you are looking for donor egg, you would reach out to the different banks, and a lot of the different banks offer different guarantees and programs. So, for example, one bank could offer 6 eggs for $12,000 Canadian and guarantee 1 or 2 embryos. Another bank could have a live birth guarantee program where you're paying more, but they're guaranteeing that you have a successful outcome. So it really varies from bank to bank. Um, the donor sperm, same thing, like it really depends. So it's best to reach out to the bank that you're interested in, and they all have coordinators. So once you find a bank that you're interested in, you would reach out to them. You would be assigned your own coordinator from the bank, and they'll be able to book an appointment with you to talk you through all the packages and see what's best for you. How do you recommend discussing third-party reproduction with my partner or family? This is a really good question. And this, I think, comes down a lot to preference. So some people are really open about using donor sperm or egg, where other people don't feel as comfortable. And it's really going to depend on your own personal situation. So as a part of using third party, you're going to complete a counseling session with a counselor who specializes in third party. So they are so good at going over everything in terms of disclosure, not just to your family, but also to the child that you're going to be having. And they can provide you with a ton of different resources as well to help you navigate if, when, and how you're going to be disclosing to your friends and family. How do you support patients through the process? So we support patients from start to finish. So we have our third party coordinator who is your initial point of contact. She's going to send you all of the information that you need to find your sperm or egg donor, or also gestational carrier. I'm not speaking as much about that, but and then we're there to guide you through the process from start to finish. So if you have questions about the different banks, our coordinator is amazing at answering them, and you can book a call with her to go over all of the options if you have questions. We're going to reach out to your donor or your gestational carrier, lay out the screening that they have to complete, make sure everything is done, and then we're going to guide you for an appointment with your doctor to gain medical clearance. So once your donor or your surrogate has completed all of their screening, They need to have an appointment with your doctor for medical clearance. So they're just going to check all the results to make sure everything looks good, and then you will complete a legal agreement. Once the legal agreement is complete, you'll have a patient care coordinator who's going to reach out with all the information about your cycle, and then you'll have your cycle monitoring nurse who's there to guide you through. And I'm always here all the time, after hours. I have no boundaries. So if anyone ever needs something, I'm always around as well. I know someone who I want to be my sperm donor. Is that allowed? Yes, absolutely. So we do work with known sperm donors. So the first step will be after you speak with your doctor, we will reach out to them to initiate the screening. So we're going to do a semen analysis, infectious disease testing, a physical. They'll complete psychological counseling just to make sure that they're a good candidate. And then once they're medically cleared, again, you'll complete legal, and then we'll bring the sperm donor in to complete Health Canada requirements. So Health Canada really strictly regulates donor sperm and egg. So there are processes and requirements that we have to meet to use known sperm and egg donors. And what that looks like is it's very specific blood work and urine testing, something called a risk factor questionnaire. Um, so we do that as close to the donation as possible. So once you have someone in mind, again, we'll reach out to you and go through what that timeline looks like specifically and the fees associated with that as well. But absolutely, if you have someone you know who wants to be your sperm donor, absolutely, yes. A good friend of mine is willing to be our egg donor. She has high AMH and PCOS. Does the PCOS itself disqualify her from being our egg donor? Not necessarily. So with PCOS, what that means is you have a lot of follicles essentially. So we don't want to overstimulate you. So you would need to have an assessment with the doctor to discuss any risks. And then most likely they would just put the donor on a very, very low dose as not to overstimulate. But it doesn't necessarily disqualify. But we would need to assess them fully from start to finish to make sure that they would be a good option. Okay, I think that's all of the questions. Are there egg banks that are preferred or linked to better outcomes? So we regularly assess the banks that we work with to ensure that the outcomes are good. There are so many banks, so many different options, so many agencies. So we're always assessing and reassessing to make sure that the patient outcomes are good. The list that we're giving you are the banks that are preferred and the ones that are linked to the best outcomes that we've seen. Um, Sometimes with like agencies, we also have a list of recommended agencies that we work with. And before these agencies are added to the list, I have a meeting with them to discuss sort of a little bit about them. Like I want to know where they're coming from, how they're processing their donors to make sure that it's going to be a good fit for our patients. Um, I think that's all of the questions. Oh, yeah. I think I've answered. I'll just give a few more minutes. If there's any other questions, you can type them in. I think that's it. Oh, there's one more there. What is the cost at Trio once you've paid for your donor egg? So once you arrive at Trio, or your eggs arrive at Trio, you'll be referred for an appointment with your doctor, and they'll put a egg thaw and fertilization protocol in place for you. And then your primary care coordinator will reach out with the fees for that. But essentially, you'll be paying to thaw and fertilize the eggs, and then you'll also be paying for any embryo transfers and medication as well. Okay, we've got a few more questions now. What does surrogate screening entail? So we would be looking at their previous birth history. We do a toxicology. They complete counseling, a physical, infectious disease testing. They have to do a PAP, a breast exam. There's also limits as to how many previous births they can have and how many previous C-sections. We're looking at BMI as well. And what was the other thing? Oh, yeah. And then the counseling. I think I said the counseling already. How do age and fertility issues influence my choice of third-party reproduction? Um, I hope I'm understanding this correctly. So your fertility issues, I mean, if you are having issues with egg quality or egg quantity, that's a situation when you would be looking at donor egg. If you're having a lot of failed transfers or there's some medical issue, or you don't have a uterus and you need to use a gestational carrier, that's when we would look at that route. And again, if you're having issues with sperm or you don't produce sperm and you need sperm, that's when we're going to look at using a sperm donor. Give everyone another minute there if there's any other questions. Okay, I think that's it. Everyone is going to be getting an email tomorrow. So if you have any follow-up questions, you can connect with our client care team to answer your questions. And then you'll also be given access to a recording of this session. And I'm also always available. If anyone has any questions, you can always email me directly, Kathleen M at triofertility.com. Thank you so much, everyone, for joining me. It was a pleasure. Take care.